Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. My email is sreeklpm@gmail.com. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. We are continuing with the series of neuroimaging concepts. So today we'll talk about cortical vein thrombosis, neuroimaging concepts, part 32, hemorrhagic stroke, part 7, cortical vein thrombosis. The thrombosis of the cerebral venous sinuses, particularly of the superior sagittal sinus, gives rise to important neurologic syndromes. So cortical vein thrombosis, one of the common cortical vein thrombosis, superior sagittal sinus thrombosis, which can give rise to important neurologic syndromes. But cortical vein thrombosis is less commonly seen as compared to arterial thrombosis. In the initial part of my discussion, I told that most of the strokes, 99% of the strokes are because of the artery and arterial thrombosis, and only 1% of the strokes is because of the veins, resulting in cortical vein thrombosis. So this is less commonly seen as compared to arterial thrombosis, but nevertheless we need to know about it because the manifestations and the treatment are completely different as compared to the arterial stroke. So when you take the cortical vein thrombosis, one of the common veins to get affected is the superior sagittal sinus. So thrombosis of the cerebral venous sinuses, particularly of the superior sagittal sinus, gives rise to important neurologic syndromes. But there are important differentiating points between the venous thrombosis and the arterial thrombosis. The first important point is that there's a slower evolution of the stroke syndrome than with the arterial occlusion strokes. Arterial occlusion strokes present suddenly. Patient is already suddenly develops a deficit. If that is the kind of the clinical scenario you get, then it is highly suggestive of arterial thrombosis. But cortical vein thrombosis, the evolution is slow. It is gradual. So a slower evolution of the stroke syndrome, if it is present, then it is highly suggestive of cortical vein thrombosis. So one of the important differentiating points between the venous thrombosis and arterial thrombosis is that arterial thrombosis is sudden to occur and venous thrombosis, there is a slower evolution of stroke syndromes. Second, there are multiple cerebral lesions not in the arterial territories. So if it is an arterial stroke, it is confined to one particular territory, either middle cerebral artery or anterior cerebral artery or posterior cerebral artery. But here, the venous thrombosis, it is not confined to a particular arterial territory. There are multiple cerebral lesions. So first important differentiating point is that it is slower in evolution. The second important point is that it is not confined to a particular arterial territory and there are multiple cerebral lesions. And the third point is that it produces more of headache and convulsions. So generally arterial strokes, they may not produce seizures unless it is seizures are may be seen in hemorrhagic stroke or embolic stroke, but generally less common. But cortical vein thrombosis, seizures is one of the important presenting manifestations. Seizures and headache are important presenting manifestations of venous thrombosis. So a person presents with stroke and seizures, always we need to suspect cortical vein thrombosis. So convulsions again favor cortical vein thrombosis. And because the venous thrombosis is there, because of the back pressure resulting in an increased pressure, there will be a rupture of the vessels resulting in hemorrhage. So again a hemorrhage is in favor of cortical vein thrombosis. So four important differentiating points between the venous thrombosis and the arterial thrombosis, that venous thrombosis, there is slower evolution of stroke syndromes, whereas in arterial strokes it presents suddenly. Second, arterial strokes, they stick to a particular arterial territory, but venous thrombosis, they don't stick to a particular arterial territory. They are multiple and not in arterial territories. And seizures are in favor of cortical vein thrombosis. Seizures are less commonly seen in arterial thrombosis, and hemorrhage due to back pressure, raised intracranial pressure. Hemorrhage is more common in cortical vein thrombosis. So if there is a slower evolution of stroke syndromes, not confined to arterial territories, seizures are present, hemorrhage is present, it is more in favor of cortical vein thrombosis. So here if we see this neuroimaging picture, we'll be able to appreciate better. So here you can see this. This is the venous sinus thrombosis, the coronal section, and sagittal cortex magnet resonance venogram. This is known as MRV, demonstrating the absence of flow in the superior sagittal sinuses. So here you can see this is the superior sagittal sinus. So you can see the absence of flow in the superior sagittal sinus. So it is well marked with an arrow. So there's an absence of flow. There's a flow void in superior sagittal sinus. Also, if you see the transverse sinus, so this is right transverse sinus. This is the left transverse sinus. Here again there's an absence of flow in the left transverse sinus. Again depicting this is a transverse sinus and superior sagittal sinus thrombosis. So note that the straight sinus and right transverse sinus remain patent. So the transverse sinus on the right side is patent, but the left transverse sinus there's a flow void. Likewise in the superior sagittal sinus also there is flow void. So if we want to analyze the cause, if we take the MRI which shows the axial cut, if you see here there's a automastoiditis which was the cause of the extensive thrombosis. The clot can be seen in the MRI. So because of this local condition, the automastoiditis, it has extended and caused the cortical vein thrombosis. So this is known as MRI brain with venogram. We are focusing on the veins. So here in this picture you can see the depiction of absence of superior sagittal sinus and the transverse sinus. So this is in the MRI brain venogram. This is a venous cortical vein thrombosis of superior sagittal sinus and the transverse sinus. So these are the wonderful concepts of cortical vein thrombosis. I hope you have enjoyed listening to these wonderful concepts of cortical vein thrombosis. The other important concepts of clinical neurology I have put in a book called Exam Oriented Clinical Neurology. This book will be very useful for students appearing for clinical neurology exams. If interested, this book could be purchased. The other important book I've written is Focused Neurology. All the important concepts of neurology I put in a question and answer format. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. This book will be especially useful for students appearing for Viva and orals. So if you have enjoyed listening to these wonderful concepts of cortical vein thrombosis, please like and share the link. But please subscribe my YouTube channel, Dr.Sreenivas Medical Concept, which is one of the India's leading neurology educational YouTube channels, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.